My name is Jonathan Brajtbord. I'm a men's health expert and board-certified urologist at Greater Boston Urology. I specialize in erectile dysfunction, sexual medicine, urinary incontinence, pelvic pain. I take a holistic integrative approach to urologic health that moves beyond the standard definition of what a urologist typically does. My passion in life is to help men create the most fulfilling life possible. The foods you eat, what you do, how you do it can significantly impact your urologic health, and my goal is to help you sort through those connections to help you lead the fullest life possible. I grew up in Dallas, Texas, and made my way to Massachusetts, where I played football at Williams College in Western Mass. From there, I went to medical school at Mount Sinai in New York City. And from New York City, I moved to San Francisco, where I completed my urology residency at the University of California in San Francisco. It was during that time that I did actually a fellowship in integrative medicine, and where I made the decision to bring those two skills, the integrative medicine as well as the men's health expertise that I gained from my urology residency, to my career. I'm married to an incredible woman. We have 3 young kids. And together, my wife and I own and run a spiritual retreat center and farm called Hawthorne Farm in the Greater Boston area. So my nights and weekends are primarily filled with being a dad to the 3 young kids, as well as working on the land and getting the farm up and running. I also love to ski, hike, and fish. Integrative men's health is a way of looking at the problems that affect men, so erectile dysfunction, urinary problems, and pelvic pain, and taking a more holistic approach. So how does your life affect these problems? How does your stress and anxiety, how does your relationships, how are they all impacted in your urological health? How do they manifest in your urological health? 3 myths about urological care. Number 1, erectile dysfunction. If it's broken, it can't be fixed. So men often come see me due to erectile dysfunction. Oftentimes it's a result of either age, medical problems such as diabetes, high blood pressure, but often a man's stress and anxiety can play a huge part of their erectile problems. I help men optimize and improve their health while we undergo a thorough evaluation and workup for the erectile dysfunction, including the use of trial of oral medicines, penile Doppler studies with injections, as well as possible surgeries or low-dose shockwave therapy. Number 2, the need to pee often is normal. So men often come see me because they feel they need to pee all the time. Sometimes this can be a side effect of BPH, or benign prostatic hyperplasia. Sometimes this can be a bladder problem. And oftentimes this can be a side effect of a man's stress or anxiety. It's just a physical manifestation of that. So I take all these factors into account when doing an evaluation for men with this problem. Number 3, testosterone replacement. Fixing a number will fix you. So for some men who have symptoms of a low testosterone, replacing this important hormone in your body can have enormous benefit to your life. Oftentimes, however, some men come see me and they feel like just fixing this number will fix their entire life. I prefer to take an integrative approach that examines your life, your habits, and your exercise routine, along with testosterone replacement, to help men truly transform their life. When some men hear the idea of a holistic, they get either turned off by the idea, or they're like, that's not for me. And what I do is I begin to start asking them questions about how they actually live their life. What do they do in the morning? What's their routine? How's their relationship with their wife or their significant other? And as men begin to see that all of these things can impact their health and their overall quality of life, they begin to start seeing that the benefits in changing some of these very basic fundamentals of their life can actually have a huge impact. And that's my goal and mission. It's not for everybody, for sure, but for the men who are interested in kind of doing some real work and to change themselves, I think I'm a great resource for them. I think Greater Boston Urology is the best option for patients out there who are seeking urological care. We have multiple office locations throughout the Boston area. We have an incredible team of physicians, PAs, MAs, office support staff to truly see patients through all their problems. When you walk into the door, I want patients, and I want my patients to feel like they are held by our community and by our company. And it's an excellent place to be able to walk patients through their problems from start to finish. We take pride in how we take care of our patients, not just getting them in and out of the door. So one of the things I love most about being a urologist is that you develop long-term relationships with your patients. So you help them with their various urological issues or ailments, and then you kind of continue to follow them throughout their lives.